We have with us today Phillip Magness, Senior Research Fellow at the American Institute for Economics Research. He's the author of numerous works in economic history, taxation, inequality, and education policy, and has been writing extensively about COVID. Phil, thanks for joining us.
Thanks for having me.
So let's go back to March. One of the things we've been trying to do is to go back to what we thought when, and how we're thinking about that with the information we had at that point. So even if it was before March, when were you started to be like, this is happening, and what are we going to do about it? What was your sort of awakening moment on COVID?
Yeah, I see the first sign that I noticed anything about it really coming into kind of a serious direction. The very end of February, the New York Times really started ramping up its coverage of COVID. And I noticed it at the time. I wasn't expecting, anything near like what we had at the moment. Or the lockdowns or anything that followed, but I noticed that suddenly their attention had shifted pretty intensely to that subject, and then some of it was actually sounding kind of a fairly alarmist direction. So this is probably around February 27th, 28th, thereabouts. And then over the next 2 weeks, I'd say the aha moment when I knew this was serious, when I knew that we should kind of buckle in for a very long policy response, was actually, I think it was on March 12th, and that was the day, not the government did anything, it was the day that the NBA canceled the remainder of its season.
Yeah, it's incredible that again, right? Individuals and reacted sometimes faster and start internalizing this a little bit quicker than governments, right?
Well, exactly. Government's the lagging indicator here.
Right. So the NBA does it, and what do you start looking at in terms of data or models, or what caught your attention in terms of the information available for that decision?
Yeah, so we saw on March 16th was the big day that major decisions were made both in the United States and the UK. And that was the day that the Imperial College Neil Ferguson model came out. And, everyone remembers that. That's the one that predicted 2.2 million deaths in the US, 500,000 in the UK, and had all these disasters. I'm sorry?
Do you remember that? But I can't remember now from the top of my head by when they predicted 2.2 million deaths in the US.
So it was a little bit unclear in the model. They were claiming, I think one version of it stated by the end of the year, but then he also gave some public comments to reporters that indicated slightly different time frames. But I think the assumption has generally been by the end of 2020.
Okay. And yeah, so that was the model that somehow changed course on the UK response, right? The UK seemed to be on the path that Sweden had decided to follow, and that model came in and changed, not only changed what the UK did, but I think it was very influential in our decision across the states here, right?
Right. Yeah. Then we have quotes from Anthony Fauci and Deborah Birx saying that they had just received the new model from the UK, and it was predicting this disaster scenario here. So it ends up being a major thing that shifts them as well as the UK government that Imperial College is actually advising.
So take that at face value. Take that model prediction as perhaps assume that was the best science we had at the time.
Yeah.
How would you take that information and think about what to do and think about the options on the table, right? And I think the main options on the table at that point in time were like, well, we can try to do this the way Sweden is doing, or we can try to do this the way Northern Italy had done, or what we decided to experiment and locking down. So what should we be looking at, even taking that as face value, that the 2.2 million deaths prediction? How do we go about making the decision?
Well, my first reaction to this, and this is probably within the days after the Imperial College model came out, is we had to look at the track record of this group of scientists, because they used an older model that was from the influenza epidemics in the mid 2000s when they adapted it over to COVID. They state this outright. They said, we're taking our old flu model because this is the closest thing that they thought they had to COVID. So my next question is, let's look how that flu model performed in 2005 and in 2009, when these were the avian and swine flu years that we did have a serious response to, but we can also evaluate against the way that the model performed in action. And it turns out, if you go dig up the articles, they were predicting hundreds of thousands of deaths with each of these pandemics, and it ends up being just a tiny fraction of that. So that immediately tells me that maybe we shouldn't put as much stock in this specific model that governments actually did. And then the second question that we need to ask is, these models are based on inputs. And back in March, even till very recently, we didn't have much in the way of reliable data on the nature of this new disease. We knew that it was deadly. We knew that it spread very clearly in nursing homes because, in Washington State, the first outbreak in the U.S. was in nursing homes. We knew out of Italy that elderly populations were especially vulnerable, and that had been where the majority of the deaths had occurred by far in Italy. But we didn't know the infection fatality rate. We still don't have a clear piece of evidence about that. And then testing was also so bad. I mean, it was just kind of like a crapshoot. You didn't really know what was going on. And yet all of these things are necessary to kind of calibrate the parameters of the type of modeling that they employed there. And that raises a huge red flag for me. That's kind of science flying blind into the wind and not really knowing what's going to happen, and yet pretending as if you have almost like this pretense of knowledge that you can project not only weeks out but years out the epidemiological pattern of this disease, and all using a model that hasn't performed all that well in the past.
Right, but so one would try to justify what we did by looking at that and say, okay, we don't know enough. There's lots of unknowns here. We don't have enough testing. We don't have enough information. But under a combination of parameters and a combination of assumptions, we're facing 2.2 million deaths.
Right.
But there's something else that was missing in that discussion when deciding, let's say, and that's the trade-off calculation, right? So
Exactly.
all right, we can sit here and let this ride, and yeah, maybe we're going to kill 2.2 million people, or we can do something that is extremely intrusive, extremely
right,
just like unpredictable in its nature and what was going to do and what's going to generate. So as the lockdown started rolling in, what were the things that you were thinking? I mean, there's the obvious disruption. Okay, well, the job market is going to suffer, unemployment is going to go. But how were you thinking about that side, the trade-offs that we're starting to face?
Well, the immediate trade-offs that come to mind is we know from past economic recessions and depressions, there's an extensive literature on this, that it actually has clear effects in both increases in substance abuse, increases in depression, which leads to suicide, all sorts of ill health effects associated with economic downturns. We know this from 2008 when the last major recession happened. Suicide spiked, alcoholism went up, substance abuse went up, and this is just a natural response that people have when there are massive job losses and poor prospects for the future. So we can reliably predict that something like that is going to happen, and guess what? It has started to play out that way. We know from some states that were not hotspots of COVID, they were even reporting suicide rates that are matching or exceeding what their localized COVID rate happened to be. So that kind of a downturn is immediately evident as something that has to be as part of the trade-off. Then you start looking at secondary and third order effects that are taking place in response to this policy. So we locked down society in response to COVID, but that also included the cancellation of what were called elective procedures in many hospitals. It shut down the remainder of the medical industry so it could reorient and focus toward COVID, so we wouldn't lose our hospital capacity for COVID mitigation. But what does that mean? It could be anything from someone who is in an early stage of cancer now has to delay treatment for several months, and that could have serious, severe effects on their expected lifespan, not maybe this year, but many years from now. It could be anything from elective surgeries that pertain very closely to the quality of life. So elective surgery is not, like to put it, it's not like getting a plastic surgeon to fix your nose or something. It could be a hip replacement. It could be a joint repair. It could be something that treats a medical problem that's not severe now, but when you get into old age is going to very, very clearly rack up and cause you problems if you don't treat it now. And what that implies is that some of the toll of this is going to not be fully felt until 10, 20, 30 years from now for many people. They're going to find diminished quality of life and maybe even lifespan itself because of treatments that were delayed in response to the lockdowns. So you start thinking about all these different conditions that come about, and it's suddenly a very severe aggregating problem that's not at all considered in the models. This isn't part of the calculations that someone like Imperial College is making. This is the cost side of a decision that's almost occurring in a vacuum.
Yeah, and so adding those things up is very difficult, of course, but at the same time, I think we treated the two sides in very different ways, right? One side being, okay, we have a lot of uncertainty, but let's take the 2.2 as face value. And the other side, let's not even talk about it. Let's not even debate that. Let's not even try to add up the things that we're going to do. And one of the things that you write a lot from I want to say like economic freedom point of view, like in a lot of things you write. And the one thing that bothered me, and I want to see your take on it, is that the notion that governments start coming in and say, we're going to decide what's essential, what's not essential.
Right.
And the sort of our inability to understand how, the economic engine connects and how things are connected to define what's essential and non-essential, it's scary. And the implications of that it's just incredible, and surprises me actually that we didn't suffer more of a disruption. But
and when you start defining things as essential versus non-essential, that's a political decision. That is the governor or the mayor of some state or city coming in and saying, we know that this type of business is necessary, but these other types of business are not. And we found this in the United States. Some things that were legal in Ohio were illegal just across the border in Michigan. So the Michigan governor deemed, I think, gardening supplies non-essential. So they had to rope off that section of the store. Whereas just across the border, you could drive 5 minutes up the road if you live near the border. You can be in Ohio, and suddenly it's a very different situation because they made it on political lines. We saw this internationally as well. There was a kind of a quirky story of a store that sits on the border between the Netherlands and Belgium. And the half of the store that was on the Belgium side was all roped off to only essential items, whereas the half of the store on the Netherlands side was basically open, with social distancing and all the usual precautions in place. But you could sell things in one half of the store and not the other half of the store. And you look at this on its face; it's just kind of absurd. So I started looking a bit into some of the history of where do we get this definition of essential versus non-essential, because it is putting it in the hands of the politicians rather than any scientific basis. And if we go back to previous pandemics where they've adopted policies to try to curtail business hours, so the famous one being the Spanish flu in 1917, there was not an essential versus non-essential distinction that was made. The measure that they used there was, and we find this in city by city by city, they keep going back to it, whether a store or facility or restaurant or public place was congested. So they were concerned about the number of people, not what the service or product being sold happened to be, which I think even though that's not a perfect response, it's a better basis to actually go by. You want to focus on the transmissibility of the disease, not whether people are choosing to buy gardening supplies or food or toilet paper or whatever it happens to be.
Right. Shutting down the dog groomer seems to be like a really bad idea, right? Given that one person interacting with one dog, that's not super clever. Yeah, we try to spend some time thinking here about measuring the susceptibility of different activities and trying to look at a trade-off between that activity, employment, and GDP, and provide that information to some local governments here. But again, there was no appetite for that. There was this sort of like dichotomy: either let's either open or close. And the use of these emergency powers to say shelter in place, stay home, somehow was seen as the I want to say what's the word? I'm lacking the word here. The sort of empathetic, the right thing to do for every individual. And you wrote a little bit about this as well, on this notion that we chose a course of action that some people think that reverting now is hurting the most vulnerable.
Right.
Easing the lockdown is going to hurt the most vulnerable. Our candidate for Senate here in Texas a while ago, Beto O'Rourke, just tweeted yesterday about how Texas is really hurting the vulnerable by opening the economy. And it's the reverse of that, right?
Yeah, it's the exact opposite of that. And you got two effects here. When they imposed the lockdowns, what types of businesses are hurt the most? It's the small businesses. It's the local one-shop operations. It's the one-shop cafe or restaurant. And a lot of these are owned by, they're owned by just a single person in the community. They're not a big chain that's nationwide. Meanwhile, Walmart and Target and all these national chains that do fall under the essential goods exemption because they provide groceries. And I'm not saying that they should be shut down. Quite the opposite of that. But they're going to be fine through this. And in fact, business is going to probably shift toward them, just like it shifted toward Amazon online. But the businesses that are going to hurt the most are those that do not have a national political presence or even a statewide political presence to kind of mount an opposition to this politically induced presence to try and put them under lockdown. Then the second thing of that, whenever you enact a lockdown, you are inviting enforcement. You're inviting agents of the state, and this is police, it's bureaucrats, it's regulators, whatever it happens to be. You're giving them a power to come in and say, anyone that violated this lockdown is now subject to either fine or arrest or imprisonment, all the usual things we do when we make something illegal. You have to expect that it's going to be enforced as it usually is by the government. They're going to send the police and regulators out. Well, what do we know about enforcement in general, even separate and apart from COVID? Patterns in police enforcement, patterns in regulatory enforcement tend to overwhelmingly be focused upon those that are least able to defend themselves. People that don't have access to high dollar attorneys, don't have corporate lobbyists. In other words, the most vulnerable members of society. Often that means poor people and racial and ethnic minorities. And we know from several weeks of COVID enforcement, and we started to get some data out of New York City on this in particular. They started to release the numbers of how many people they had arrested for violating the lockdown, and then they did the racial breakdown, and it turned out over 80% were either African American or Hispanic. And this is a very large, diverse city, but they all happen to be, all the arrests happen to be in just basically two racial and ethnic groups. Something is not right there. Something's very discriminatory there in the way that this is being enforced. And it's almost as if they're going into the poorer neighborhoods and then the minority neighborhoods looking for lockdown violators. Meanwhile, in the wealthy neighborhood in downtown Manhattan, they're kind of looking the other way. And this it's almost a public choice effect, because you know that of who's going to be able to hire an attorney, who's going to be able to call attention to abuse of enforcement, and then who isn't. And the people
At the
that
same
aren't
time, the most vulnerable, the poor, have more of an incentive to go out and not obey the lockdown, because
exactly, because
the marginal benefit of working a day is much higher for them, right? Than for a professor sitting at home still working like me, where my life. So the word, I like the what was it? A lot of the epidemiologists and some health officials using the word, oh, this is an inconvenience.
Right.
It might be an inconvenience for me, maybe for you, but for a lot of people, it was not an inconvenience. It was like a destruction of their livelihoods, right? And so that the condescendency of that word is just like unbelievable.
Yeah, and we saw that all over as the blue check Twitter mafia, if you want to call them that. Most of these are people that are academics, or they're reporters. They're middle class, upper middle class people who are able to work from home. They can work from home. But if you worked in the service industry, if you worked in retail, jobs that are more commonly associated with minimum wage jobs, and this is your only source of livelihood or income, and you can no longer go to work because your business is shut down, you can't sit there and watch Netflix all day and continue to collect your salary and do a Zoom meeting to teach your class. Your livelihood is cut off.
Right. So but we did it, right? So we did all these mistakes of not really considering lots of different alternatives. One of the things that I think was very, very not necessarily fair to the public is the fact that the goalposts shifted as well, right? We had this idea that, well, maybe we're going to do this for like 2 weeks to flatten the curve. That was the term that went viral. With the idea of flattening the curve, it was not an idea of changing the total number of infections, just like smoothing the path, slowing the rate of infection so that we don't overwhelm capacity. And maybe I think the target in the beginning, people probably hoped that was like, oh, it's going to be a 2-week thing, which not that big of a deal if it's like a extended, holiday 2 weeks, right?
Yeah.
But what with 2 weeks became 3 months,
Yep.
and the goalpost started thinking, well, now we just nothing about flattening the curve is about somehow eradicating the disease. So
Right.
what was the dynamic that you saw that led to this sort of shifting in the goals of the politicians here?
Yeah, it's almost like they sold the bill of goods to start off with it, because it was all about flattening the curve. That was the meme circulating around the internet. It was the talking point of Anthony Fauci and all these public health officials. We're going to do this for a couple of weeks because we need to flatten the curve to preserve our hospitals. And just as you said, that passes by. That deadline passes, and it's, oh well, we need to extend it from April 1st to April 15th. April 15th to May 15th, May 15th to June, and so on. So it's been just kicking the goalpost even further down the line, and even to the point that I was reading an article in the New York Times yesterday where they were trying to compare the European response, the Western European response, to the American response. And now all of a sudden the talking point is that Italy and Spain actually did something right, because even though they had a sharper peak in the total number of deaths, they also had a sharper decline. And then they have this overlaid with the chart of the United States that has a milder peak and a milder decline. And I'm sitting there thinking, wait a minute, this looks a lot like the flatten the curve argument that you were using back in March, and now you're saying that this is wrong. It's almost like this this internal disconnect of where they're out searching for a justification for the lockdown rather than making the lockdown based on sound science itself.
Right, right, and here you are again, right? Because we're in the middle of June now, and places like Texas, where I live, where we
Yeah.
are, that did not have a first wave. So Texas, the reality is that people start talking about a second wave, we just did now have a very mild number of cases in Texas throughout. Texas still is the state with the lowest death per capita of any significant large state, right?
Yeah.
And then guess what? Yeah, we move out of a 2-month lockdown to say, like, listen, we cannot just hold on the line here. So let's say you don't have enough cases and you keep shut down forever until a vaccine comes up. That's not an option, right?
Right. That's not
Our governor has been opening things up, and life goes back to normal. If you look at all the mobility data, Texas seems to be back to a normal level of activity. And fair enough, there's there's the growth in the cases, there's growth in hospitalizations, which were to be expected, right? That's exactly, there's no fighting that. That's just no avoiding that. But you see again, I think a lot of the same type of rhetoric of like, well, see, that was a mistake to open it up. I was like, well, what was the alternative?
Right.
I see what the alternative was. And
Right. The alternative
across the similar comparison you see between Europe and the US. Now you see between the hard hit blue states in the Northeast. Oh, they did it right. Like, wait a second. New York has 1,000 deaths per million. Texas has 70.
Right.
But anyways, I'm not saying that Texas has to get to 1,000. I think now we learned so much more, right? So actually, let's move to that part. And we did all this, and now we're here in June, and we learned a lot more about the uncertainty we had in the beginning that might have been uncomfortable and made politicians sort of, a panic and opt for a lockdown type strategy. What do we know now? How do you see what we know now, and what we're going to go be doing moving forward?
Well, so the biggest point of data that's been added into our mix, or I guess more so confirmed, because we had early signs of it, was just how disproportionately this disease affects the elderly. And it's even to the point, so it's a very severe risk among the elderly. It's a very mild risk among younger people and healthier people. And of the younger people that have died from it, there's overwhelming evidence that they are people with other medical conditions that exacerbate it, which is tragic and horrible in its own right. I don't want to downplay that. But we very clearly know that this is a disease that disproportionately affects the elderly. What does that tell us? Well, it tells us that maybe we need to consider different approaches to our policy responses that were not there back in March. The foremost among those being the nursing home issue. So I've done a little bit of data work. Unfortunately, the states are not very good at keeping these records. But Massachusetts, which is where I live, has, they've actually have really robust daily data on COVID cases and the fatalities that come out of those. And they started back in early April, they started tracking the daily deaths in nursing homes as opposed to the general population. And they discovered something really quick early on. So back in April, it was about 50% of all deaths of COVID in Massachusetts were in nursing homes. Nursing homes that accounted for, I think there was a population of about 50,000 people in a state of 7 million. So it's a tiny portion of the population is accounting for half of all COVID deaths, and that number's increased. It's now hovering around 63, 64% of COVID deaths in Massachusetts are from nursing homes alone. So this is telling me something very, very pronounced. It says that we not only have an acute vulnerability among elderly people, but it's also an acute vulnerability among elderly people in a certain type of scenario, a certain type of facility. So that tells me you need a policy response targeting and figuring out a way to lessen the susceptibility of nursing homes. And that could be, maybe that could include you have tighter restrictions on entry and exit into them. Maybe it could include spreading out or dispersing the population of the nursing home. A big one that's come up, a lot of states adopted these bizarre policies that required nursing homes to readmit COVID patients. And that they end up being carriers that bring it into an otherwise secure facility. And next thing you know, half of the residents have contracted the disease. So there's all sorts of things that could have been done for nursing homes and still should be done, but were basically omitted from this general top-down, one-size-fits-all approach that we took back in March. And then the final complication of this, we talked about the Neil Ferguson Imperial College model, which is all premised upon agent-based interactions as a simulation model in the general population. It's what happens if we do business as usual and people contact 5 people in the course of their day going to work and school and stuff. Then we close down work, we close down school, maybe that reduces to 2 and that limits the number of interactions. So it's a sophisticated model, but it's a general population model. You go back to the 2005 paper where they first developed this model, and they say quite explicitly, we do not account for group residences such as nursing homes, prisons, and care facilities. So the model that we based all of this policy response on, this sophisticated agent-based simulation for the general population, did not even account for the one area that's turned out to be far and away the single biggest cause of COVID deaths. Another way of saying that is the model that Neil Ferguson and Imperial College used, it predicted a certain type of deaths, but they are not the types of deaths that we are actually seeing. So that tells me maybe we need to step back and reevaluate even the core empirical basis that we made these decisions on, and taking new knowledge, abandon lockdowns entirely and look to a more focused policy that looks at nursing homes, that deals with the nursing home problem.
Right, and the nursing home problem is a very sad one, because it seems that nobody in the Western world has been able to deal with that correctly. Right?
Exactly.
So Sweden, I think the response in Sweden has been very measured, but they did a bad job with nursing homes, and that's in the UK, in Germany, like pretty much every country outside of Asia where I don't think they have the system of nursing homes. Right, parents,
right.
Maybe that somehow. I don't know. It's hard to exactly understand why the death rate in Asia was not as bad as in the Western world, but it's just like a tragic. But that tells us about the different type of response moving forward here.
Exactly.
For sure. And so you also talked about one thing that you wrote about is about the idea, going back to Neil Ferguson, unfortunately, is claiming victory, somehow claiming the treatment effect that we like to call of the lockdown. So some folks will go out there and say the lockdown saved 3.1 million people. I think that was the shot of the Nature sort of, I wouldn't call it a paper, it could be like blog that was posted.
Right.
How do we think about that?
Yeah, so this is a major problem with the epidemiology literature, and this is something that I love as a social scientist, just for an intellectual exercise to look at this stuff, even though the implications are very profound. So one of the great problems of empirical social sciences is, as you referred to, is inferring causality, detecting causality. It's really easy to figure out that 2 things correlate with each other, 2 trends correlate, but proving that one caused the other is a statistical conundrum. This is something that social scientists have been working on for millennia, basically. If you figure out how do you track whether one variable causes the other to happen? How do you separate these two things? And the statistical tools that we have for inferring these are very sophisticated, but they're also relatively in their infancy. This is something that emerged basically in the late 20th, early 21st century, the most advanced causal inference techniques that we have. And they're very prominent in political science and economics, some of the physical sciences as tools that are just now starting to be explored. But if you look at the epidemiology literature, it's almost non-existent. They aren't using causal inference. So that study, if you want to call it a blog post in Nature, what they did is they took their own model, the Imperial College model, and they projected the number of deaths that they assumed would happen without the lockdowns. And then they do a subtraction exercise. They take the difference between that and the actual deaths we have, and they say, aha, we saved 3 million people, or we saved 200,000 people here and there. That's not social science. That's about the same level of sophistication as when Donald Trump tweeted before March 2020 and says, the stock market's rising, therefore I caused it. So that's the problem. And I see this as a major deficiency of the epidemiology literature right now. So I'm working on a separate paper. It's kind of a lit review of all the studies that claim to prove the lockdown effectiveness to see if they have a causal inference mechanism in there. Do they use difference in difference? Do they go even a little more sophisticated, use like a synthetic control to create a counterfactual that they can judge something against? And very, very few papers have even awareness of that. And the ones that do, I think there have been two or three synthetic control studies so far. One was on Sweden, and its conclusion was that the lockdowns did not work. They were ineffective. The counterfactual was no different than what Sweden happened. The other was on Wisconsin that looked at when the date when the Wisconsin.
There was discontinuity in the policy.
Yeah, so you've got a treatment effect on an exact date, easy to isolate. We can see if there's a spike in deaths afterwards, and quite the opposite. Wisconsin's been on a continuous downward trend since then. So the only studies that have really looked at this that have robust causal inferences are coming up with the exact opposite conclusion from these mathematical models that just assume by subtracting reality from their own projections that they must have caused it.
And the other thing missing in all those is going to be also the fact that it's not enough to look at a point in time, because again, even if the lockdown, even if I give you the lockdown somehow stop all disease spread, well, it gets reintroduced, and later on, until so the only way that I think the lockdown could effectively get rid of deaths would be by locking down entirely without any interactions until an effective vaccine is put in place.
Exactly, which is not insane. That's implausible.
Yeah. So I think once you look over a period of a year or the cycle of the disease, right? That's when I think you're going to be able to say something more clear about, let's say, the Sweden experiment versus the other Scandinavian countries, for example.
Exactly.
Or anyway, but that's definitely not yet available. But it's unfortunate how the claims are too quick, because I think they're coming in and trying to justify new lockdowns coming about, right?
Yeah.
So they're using that information, say, see, Texas should lock down right now, because that's the only way to save lives.
It's like this bizarre default position that we always go to the lockdowns. And here's another discovery that just kind of shocked me. This was a big aha moment when working in some of this literature, because I'm an economic historian by background and training. I like to look at past events to compare to, and that's both hundreds of years ago or recent history. And I found this paper that came from 4 leading epidemiologists at Johns Hopkins University. It was published in 2006. And this was in the midst of some of the influenza discussions that were happening around then. They were also really concerned about bioterrorism. So like an outbreak of Al-Qaeda using chemical or biological agents to cause an attack. So this is a big point of attention, but they asked the Johns Hopkins team, what are the policy interventions? And this paper that summarized basically all the literature had a stunning conclusion in it. It said that wide-scale, what they called were quarantines, or what we'd call lockdowns now. So the language has shifted though. They said wide-scale, society-wide quarantines or lockdowns should be taken out of consideration entirely because there's no evidence that they work. This is all just theoretical models. We don't have any clear cases from past pandemics. There's no natural experiment that has shown these things are justified. It's all just existing in this theoretical world of epidemiology models that have just assumed it to be the case. So this is kind of like a stunning revelation. It shows that not only are critics of the lockdown existing outside of the field of medicine and epidemiology, there are internal critics to epidemiology who have been saying quite consistently for some time that we don't really know what we're doing here when we're enacting these policies. And yet you have a political culture, a media culture, basically public choice effects. What does the media like to do? What's the same thing that happens? Y'all are in Texas, you know, hurricanes in the Gulf Coast. What happens whenever there's a hurricane in the Gulf? CNN and the whole news crew descends on the coast, and they're standing out in the middle of the storm trying to predict the disaster. Uh, Media is very, very susceptible to hype. It's very susceptible to alarmist claims. And lockdowns are very synchronized to addressing alarmist claims. So they tend to get preferenced in the public discussion by reporters, news crews that are all about showing the flashy shot of the disaster happening and not really interested in the measured policy discussion that needs to take place to deal with something like this.
So let's start to talk a little bit about speculate, I guess, on why. Why is it that I feel that our elites fail us miserably because, you know, if the media is doing what they do, which is like, yeah, if you bleed elites, right, that's what they do. And that's always been unfortunate. It's not a new phenomenon. I think maybe now we like to talk about social media being like a sort of potentializing more that sort of like fill in the flames that media likes to look for clickbaits and so on. But that's definitely a new phenomenon with social media. But the elites typically are more into measured responses for situation of crisis and you know any other measure political any other public policy choice. So what happened? Why is it different here? Why? And, you know, I would blame our field as well. Us academics, economists, I think were incredibly silent at first. They did a lot of good work after in terms of like, oh, we can adapt. We you know, economists are better modelers than epidemiologists. So they're able to quickly write models. They're like, see, actually, this is a little weird. But at the first time, in the beginning, when lockdowns were being considered, there was silence. There was silence across the academia, across the elites, and whether they were Republican governors or Democratic governors, they locked everybody down. I think the one governor stood out, which is South Carolina governor.
Right. Yeah, there are very few.
So why? How is that? How do we get there?
Yeah, so I keep going back to, in my mind, we look across both the physical and social sciences. We have been dealing with, something that's referred to as the replication crisis in data for decades. This is a well-known phenomenon. It exists in economics, biology, physics, you name it. And this is the problem of elites, intellectual elites in the academy publish work, including in top journals, that other scholars come back and they just try to replicate it, try to run the same test, and they find out based on the available information it can't be done. And there's been very little correction that's taken place on that. I think this is a problem across multiple fields, but it really kind of burst into the open at the outset of the COVID crisis because everyone was like, okay, well, this is the epidemiologist's turf, we'll defer to them. We'll let them call the shots early on, and we're going to sit back. We're going to wait to weigh in. And part of that's there's some humility built into that. But the problem here is when you have epidemiology, it turns out to also be afflicted by a replication crisis of its own, also be afflicted by bad data of its own. That basically just let it run wild with some really suspect work. And I hate to keep harping on the Imperial College model, but it's the major model that's driving world decisions. It's the one that other countries are replicating, and it turns out to just be a bad model, just be very ill-suited for the situation that we encountered. And yet there was like this deference that we have to give it over to the epidemiologists to run with it. Complicate that even further. We've seen this in the subsequent months, is there's almost been like a self-inflicted discrediting of the science by all these changing standards, the changing goalposts we were talking about, even anything as simple as advice. We heard the other day, Anthony Fauci basically admitted that the government lied about mask recommendations back in February and March. They were discouraging people from buying masks, not because that was what the medicine said, but they were trying to preserve the mask supply for the hospitals. And now he's saying, oh, now we have enough masks so we can reverse courses. That may be some sort of a shrewd political trick. It does not help the condition of science in the public's mind. It undermines the respect and trust that we were supposed to place in people that are exercising expertise. And we see this up and down the epidemiology profession. The other one that's come out was when we had the Black Lives Matter protests pop up. And I think there are some very legitimate causes that people are protesting here. That the murder of George Floyd is horrific. And I think almost all Americans were in agreement that it was horrific. It reflects a real serious substantive problem with our police culture that I support addressing, that I think most reasonable people think that we need some sort of solution to. Nonetheless, those protests burst out into the open in kind of an uncontrolled way. They kind of happened in defiance of the lockdowns and very unexpectedly. It's a spontaneous emergence. Well, what did the epidemiologists do in response to that? The very same people who were scolding and finger wagging at just everyday life actions of going to your barber shop or going out to the store in public only 2 weeks prior changed their tune. They became political messengers rather than scientific messengers and started carving out all of these like really tendentious excuses of why the current wave of protests was not as vulnerable to COVID as we had all been just 2 weeks prior. So they sent a very inconsistent message there, even to the point where some of the most prominent epidemiologists at like University of Washington and Yale University, there were two very pronounced outspoken epidemiologists that had been up until just a few days before the Black Lives Matter protests broke out, scolding people for violating the lockdown, for going out in public. This is a time of public health crisis and we must all do our part, but they politically sympathized with the Black Lives Matter protests. So just in the course of a couple of days, they completely flipped their message. And I'm not judging sympathizing with Black Lives Matter as a protest cause. That's valid. But I would judge a scientific expert who is predicating his or her own advice on whether we should shelter in place strictly on whether they politically agree with the reason to violate the shelter in place or not.
And again, like the interesting part of this, like the movement being very critical of the way we enforce rules.
Yeah.
It's this movement that before weeks prior is saying, let's have these rules that have to be enforced by police.
Right. Yeah. And you saw that. So before George Floyd, there was another kind of viral video that circulated, and it was of an African-American man on a bus in Philadelphia. And he wasn't wearing a mask, even though there was no rule in place that said he had to wear a mask. But some transit police decided, no, you're not wearing a mask, you need to go. And they were dragging the guy off the bus and slamming him to the ground. It's horrific to watch. And you're sitting there thinking, wait a minute, this is actually the same problem. And 2 weeks ago, all you epidemiologists were okay with this type of enforcement. And now you're saying that you recognize the problem. That's telling me that your message as a scientific community is not rooted in science at all.
So let's wrap up by again speculating a bit by the future here.
Yeah.
So it seems to me that this episode is going to have a lot of consequences to a lot of our institutions, and
yes,
and, there's the obvious financial consequences that all of us are going to suffer. And universities are in dire trouble. Yeah. I see one of your books, Crackers in the Ivory Tower, in the back there. I really enjoyed the book, even though it's very critical of my business.
Right.
Justifiably critical of my business. So that's great. There'll be a lot of adjustments and things that we're going to have to do. But I think the two institutions that I'm thinking about is science, generally speaking, not necessarily through university, but just science, generally speaking, and governments. The fact that we all of a sudden realized that safeguards that we had about dictatorial powers, the government, that we don't allow governments to have, they had it by just calling an emergency.
Right.
Call it an emergency apparently can put me in house arrest for 3 months. It's
Yeah.
like,
Basically, a suspension of our democracy, effectively.
effectively, right? So policies with enormous consequences, they were not legislated. They were just done by fiat by 50 executives around the country.
Yeah.
So I those two things I think are going to have a huge rediscussion about it. So how do you see that playing out? What's your...
Well, and again, it taps into the extent to which scientific expertise has engaged this self-inflicted wound. They've discredited themselves. It's almost like the old story about the boy who cried wolf. The next time when the wolf actually comes, people are going to be much more distrusting of that level of expertise, because I think it's pretty clear now that the scientific advisors as well as the politicians overplayed their card. They overreacted with a general sweeping policy nationwide when it should have been a much more targeted policy around nursing homes and other things that we can maybe effectively control. So I see a lot of mistrust emerging in the future to invocations of scientific expertise as a basis of emergency, and that can have problems in both directions. It can have problems in both undermining future attempts to enact similar policies, but it can also make people more skeptical and more distrustful when an actual emergency does happen, a much more severe, whether it's a pandemic or natural disaster. They've kind of painted themselves into a corner now where their credibility is on the line, and people really don't know where to go to trust it. And then the second thing, and this is what really alarms me, is that I think some of the way that the protests to the both in Black Lives Matter and the lockdowns themselves have played out have unfortunately incentivized people of authoritarian stripe on both the far left and the far right to really enter into the political dialogue. These are people that are reacting to heavy-handed enforcement across a multitude of policies, but they're reacting in such ways of either saying, well, we need the police to crack down even harder, or we need to engage in violence to topple the system or topple types of government that we don't like. Those types of reactions, I think, are fundamentally authoritarian and premised on extremism. And I think very unfortunately, the way that this whole thing was played out, it's almost like the politicians thought that they could carefully measure and implement a lockdown and keep extending it, and there'd be no consequences. That we get to the point where we very lightly and in a managed way remove it. Well, that's not playing out at all. People are basically discarding the lockdowns on themselves because they were extended far beyond what people were willing to countenance, and now it's kind of a chaotic structure and response, and that chaos has unfortunately opened the door to some very ugly authoritarian tendencies.
One of the things that from the very beginning, I think one of the Swedish epidemiologists, if you ever watch some of the interviews of their interviews, I recommend, because they were very level-headed from the very beginning. And one of the things that this old gentleman said a couple of times is that I don't understand what's the plan that any of these countries that are locking down have to unwind the lockdown.
Exactly.
There is no data that will allow them to see like, okay, now we can open it up, because there will be no data unless a vaccine comes about. And I think, again, the sort of beyond the data on the scientific side, the aspect of like social interactions and unrest that might be created. Like, what is the plan? How do you undo this? It's going to be very difficult. And we're seeing that not only here, but pretty much everywhere, right?
Absolutely. So
Phil, thank you so much for this. Thanks for all the writing you do on lots of topics. And in particular, it's been very useful to read your columns in the past few months. And hope to see you in Texas at some point, not in the so distant future.
Yeah, exactly. Thanks again.
Thanks a lot.